If you're taking vitamin B12 every morning, the very thing you believe is safeguarding your health might actually be endangering your heart and brain. This is especially critical if you're over 60 and on certain common medications. This is information you cannot afford to overlook. Seniors, if you're taking vitamin B12 each and every morning, pause and watch this before your next dose. As you're watching this right now, something is happening inside millions of seniors across America, and it comes with no warning signs. No pain, no dizziness, no chest tightness, nothing that would make you set down your coffee and rush to call your doctor. Yet, it's silently increasing the risk of stroke and heart damage in people who think they're doing everything right. One of the most trusted supplements, vitamin B12, can become dangerous when combined with the wrong medication. And here's what your doctor likely hasn't shared with you. When high doses of B12 are mixed with one of two common medications, it forms a molecule called homocysteine that acts like sandpaper on the inner walls of your arteries, multiplying your stroke risk. Today, I'm revealing which two medications are hazardous to combine with B12 after age 60, and exactly how you can protect yourself. Before we dive in, drop a comment and let me know where you're watching from. Hit that subscribe button and turn on notifications because I share life-saving health insights like this every single week. Now type your age in the comments right now, just your age, because what I'm about to share impacts you differently depending on how long you've been on these medications. Here's something important to understand before we go further. A study published in the Journal of the American Medical Association discovered that seniors who took high-dose B vitamins, including B12, over long periods actually experience increased cardiovascular risk under certain conditions compared to those on lower doses, not decreased, increased. That finding shocked many in the medical community. But once you grasp the mechanism, it all makes perfect sense. Let me introduce you to Dorothy. Dorothy was 71, sharp as a tack, a retired schoolteacher. She walked every morning and took a handful of supplements with breakfast because she'd read that after 60, the body doesn't absorb nutrients as efficiently. B12 was at the top of her list. She prided herself on being proactive. What Dorothy didn't realize was that she'd been on metformin for type 2 diabetes for nearly 8 years. And for 8 years, no one had ever explained to her what metformin does to B12 absorption over time, or what happens when the body tries to compensate. Her daughter noticed Dorothy had been growing more tired than usual over the past few months. Not sleepy tired, but drained in a way that rest didn't fix. Dorothy assumed it was just age. When her blood work was reviewed, including her homocysteine levels, the results revealed a pattern that was becoming all too common. Her homocysteine was dangerously high. Her B12 levels were actually elevated from supplementation. But together, these two factors told a story of silent vascular damage that had been building for years, all while Dorothy did everything she thought was right. Comment Dorothy if this story resonates with you. Let me break down exactly what's happening in your body and why the combination of B12 and these two medications creates a problem that standard checkups almost never detect. The medication connection. Explained, the first medication is metformin. If you have type 2 diabetes, there's a strong chance you're taking it. It's one of the most prescribed drugs in America for blood sugar control, and it's highly effective, but metformin has a side effect that most patients are never clearly warned about. Over time, especially over years, it interferes with something called intrinsic factor in your gut. Intrinsic factor is a protein your stomach produces that acts like a delivery vehicle for B12. Think of it as a taxi. B12 hops in, and the taxi drives it to where it's needed in your bloodstream. Metformin quietly damages that taxi system, making it less reliable. So your doctor sees low B12 levels and says, "Take a supplement." And you do. You buy a high-dose B12 tablet because more seems better. For a while your blood levels of B12 rise and your doctor says everything looks fine. But here's what that blood test isn't showing you. It's not revealing what's happening downstream. Because when B12 can't be properly processed and transported due to the damaged intrinsic factor, it begins to interact with another molecule in your blood called homocysteine. And homocysteine is where things get truly dangerous. Homocysteine is an amino acid your body produces naturally. In small amounts, it's harmless. Your body uses B vitamins, including B12, B6, and folate, to convert it into something useful and clear it from your bloodstream. But when that conversion process is disrupted because B12 isn't being absorbed or processed correctly, homocysteine builds up. Elevated homocysteine in the blood does something very specific and very damaging. It acts like sandpaper on the inside walls of your arteries. Hit that like button if this explanation is helping you understand what's happening in your body. A research team at Harvard Medical School described it this way. Elevated homocysteine doesn't cause a sudden blockage like a clot does. It causes chronic abrasion. It inflames the arterial wall, makes it stiff, and makes it easier for plaques to form while reducing the vessel's ability to expand and contract like a healthy artery should. Think of your arteries like a flexible rubber hose. When they're healthy, they stretch and rebound with each heartbeat. But when homocysteine has been scraping those walls for months or years, the hose becomes more like a rigid plastic pipe. And rigid pipes don't flex under pressure. They crack. In your cardiovascular system, a crack like that is a stroke or a cardiac event. How many of you have been on Metformin for more than 3 years and taking B12 supplements? Be honest with yourself right now, because this combination is happening in people's bodies every single day and almost no one is connecting the dots. Why most tests don't detect it now? The second medication I need to tell you about is even more widely used, and its interaction with B12 is different from metformin's, but in some ways even more unpredictable. These are proton pump inhibitors, PPIs, commonly known as medications like omeprazole and pantoprazole, which reduce stomach acid. They're prescribed for reflux, acid damage, and ulcer protection, and they're extraordinarily common among seniors because acid reflux becomes more frequent after 60 as the digestive system changes. But PPIs do something most people never hear about at the pharmacy. They reduce the stomach acid necessary to release B12 from food in the first place. Your body needs an acidic environment to break down the protein bonds that hold B12 in food. When you reduce that acid with a PPI over months and years, your dietary B12 absorption drops significantly. A study published in the Annals of Internal Medicine followed over 25,000 patients on long-term PPI therapy. It found that after 2 years of continuous use, PPI patients showed measurably lower serum B12 levels. So what do most doctors do after that? They recommend a B12 supplement, which makes sense on the surface. The problem is that in certain individuals, especially older adults with reduced kidney function, the B12 supplement isn't processed and cleared efficiently. It accumulates in the blood in a form that interacts poorly with the homocysteine cycle we just discussed. But here's the part that's particularly alarming. Some patients on long-term PPI therapy develop something called rebound acid hypersecretion. This means that when they stop the medication, or even as it's metabolized overnight, the stomach overproduces acid as a compensation response. During that rebound window, the homocysteine B12 supplement is being processed in an unpredictable environment. Absorption becomes erratic, and erratic absorption means erratic homocysteine management. Some days the system clears it, some days it doesn't. When was the last time your doctor asked you specifically whether you were on a PPI and taking B12 at the same time? Type never in the comments if that's the case. I want to see that number because I suspect it's going to be eye-opening. The homocysteine connection. Here's where everything we've covered comes together. Homocysteine is the heart of this entire issue. Homocysteine is one of those numbers that almost never appears on a standard blood panel. Your doctor checks your cholesterol, blood sugar, thyroid, maybe even your B12 levels, but homocysteine requires a separate test, and it has to be specifically ordered. The Cleveland Clinic has called elevated homocysteine a significant and under-recognized risk factor for cardiovascular disease in adults over 60. Yet most seniors have never had it tested in their lives. Here's why that matters so much. When your homocysteine levels stay elevated over months and years, 3 things happen inside your cardiovascular system. First, the inner lining of your arteries becomes inflamed and begins to lose its natural smoothness. Second, small oxidized particles of LDL cholesterol find it easier to embed in those inflamed walls and form plaques. Third, the plaques that form in a high homocysteine environment are more likely to rupture unstably, meaning they break off and travel in the bloodstream rather than staying in place. That last point explains strokes in people who show no major blockages on imaging. The plaque was there, it was just unstable, and it broke loose. Researchers at the Mayo Clinic have found that elevated homocysteine is present in a disproportionate number of these so-called unexplained strokes. The cause wasn't mysterious. The right test was never ordered. This isn't meant to scare you without purpose. It's meant to give you the knowledge that puts the power back in your hands. Why more B12 isn't always better. Now that you understand what's happening inside your body, let me tell you what you can actually do about it. The answer isn't to stop taking B12 entirely. B12 is genuinely essential, especially after 60. A deficiency can cause nerve damage, fatigue, cognitive decline, and, yes, cardiovascular risk of its own. The goal isn't less B12. The goal is smarter B12. First, if you're on Metformin or a PPI, the most important thing you can do right now is ask your doctor to test your homocysteine level and your active B12 level. Not just total B12 in the blood, but active B12, the form your body actually uses. Total B12 can appear normal while active B12 is low. This distinction is critical, and it's one many standard tests miss. Second, the form of B12 matters enormously. Most supplements on store shelves contain cyanocobalamin. It's the cheapest form to manufacture, but it requires your body to perform several conversion steps before it can be used. For older adults on metformin or PPIs, those conversion steps are often compromised. The form called methylcobalamin bypasses most of those steps. It's already in an active, usable state. Research published in the European Journal of Clinical Nutrition found that methylcobalamin raised functional B12 levels more reliably in older adults than cyanocobalamin at equivalent doses. Third, dose matters more than most people realize. High-dose B12 supplements in the range of 1,000 to 5,000 micrograms daily are commonly sold and taken, but the body can only absorb a small fraction of that without intrinsic factor. The rest floods the blood in a form that may drive the homocysteine imbalance we've discussed. A more targeted dose of 250 to 500 micrograms of methylcobalamin, taken with a B6 and folate combination, gives the homocysteine cycle everything it needs to function properly, without overwhelming the system. Fourth, talk to your doctor specifically about your medication list in relation to your supplements. Bring this up at your next appointment as a main agenda item, not a passing question. Say, I want to discuss my B12 supplementation in relation to the medications I'm on. That conversation alone could change the trajectory of your cardiovascular health. Signs your body isn't using B12 properly. Let me tell you about Beverly, because her story is the one I want you to remember. Beverly was 74 years old and had been on a PPI for 14 years, supplementing with B12 for the last 5 of those years. Her daughter had watched a video about homocysteine and heart health and convinced her mother to get tested. Beverly was skeptical. She felt fine. Her blood pressure was managed, she walked her dogs every day, and her energy seemed normal. Her homocysteine level came back at 31 micromoles per liter. The safe range is below 15. At 31, she had more than double the level associated with a significantly elevated stroke risk, and yet she had no symptoms, no warnings, no clues, just a number on a page that explained exactly why her arteries were working harder than they should have been. Her supplement was switched to methylcobalamin. A low-dose B6 and folate supplement was added to support the homocysteine conversion pathway. The B12 was timed away from her PPI dose to maximize absorption. A follow-up homocysteine test was scheduled for 90 days later. When Beverly returned 3 months later, her homocysteine had dropped to 17. Not perfect yet, but moving in exactly the right direction. She told me she didn't realize how tired she'd felt until she started feeling less tired. If you've been doing this for years, it's not too late. The body has a remarkable ability to recover and rebalance when given what it actually needs. The vascular inflammation that homocysteine causes isn't permanent if caught before a major event. Beverly proved that in just 90 days. How to support your body safely? Here's your clear action plan. Check your medications. Are you on metformin for diabetes or a PPI like omeprazole for acid reflux? Check your B12 supplement. What form is it? If it says cyanocobalamin, you need to switch to methylcobalamin. Check your dose. If you're taking more than 1,000 micrograms daily, you're likely overdoing it. Schedule a homocysteine test. Call your doctor tomorrow and specifically request a homocysteine level test along with active B12. Add B6 and folate support. These work synergistically with B12 to process homocysteine properly. Here's what you've learned today. Metformin and B12 create a dangerous interaction through the intrinsic factor pathway, leading to elevated homocysteine and arterial damage over time. Proton pump inhibitors reduce the acidic environment needed for B12 absorption, creating an erratic processing environment that disrupts the homocysteine cycle. Homocysteine is almost never tested on a standard panel, and elevated levels in seniors are a significant, under-recognized cause of stroke and cardiovascular events. The fix isn't stopping B12, It's switching to methylcobalamin at a smarter dose with B6 and folate support. Final advice and key takeaways. Comment below and tell me if you're on Metformin or a PPI and taking B12. I want to see how many of you this applies to. And if this video helped you understand a danger you didn't know existed, please share it with someone over 60 who's taking these medications. Your share could literally save someone from a stroke. Don't forget to like and subscribe for more evidence-based health information that your doctor simply doesn't have time to cover in a 15-minute appointment. This is not medical advice. Always consult with your healthcare provider before making changes to your supplement routine, especially if you're on medications. Thank you for trusting me with your health education today. You now know something that most people have never been told, and that knowledge belongs to the people you love too. Take care of your heart, and I'll see you in the next video.